healthcare should be centered around people. Healthcare is a social space. It is humans helping humans, right? It is people taking care of their family members. It is nurses taking care of someone's daughter, right? It is doctors taking care of someone's husband. Like, these are families and communities that we're talking about at the end of the day. So I think it's incredibly important to humanize what the work is. And one way to do that is to center around people's stories as a source of innovation. I think oftentimes in the healthcare space, when we think of innovation, we think of like fancy new technology and devices and all the things that beep and sound and alert us and make things like efficient. And that is great, but it has its limitations if the technology or the solution is not designed around people's lived experience, period, right? Also, it doesn't work if the overall healthcare system is failing people, right? In the form of just not being able to even access the doctors or specialists that you need when you need them, right? Or in cases where we're seeing, even in the US, hospitals closing, right? So people in very vulnerable communities, so people are no longer even able to access the care that they need. So I think it's incredibly important that we're thinking about the individual person and their story, but also looking at the systemic reasons why like healthcare costs so much and is highly inaccessible for a large portion of the population. And where I see an opportunity is technology is opening doors. It is allowing us to do things that we were not able to do before. And I think AI brings a whole nother possibility for us, right? To give power back to individual people so that they can have more say in how their care is being managed, so that they can have more say over their healthcare data as well.